Today I am going to talk to you on diabetes mellitus type 2, basically those who are having high blood sugars and not bothered to control it or not bothered to take the help of a medical practitioner or not bothered to take the help of healthcare worker, and their blood sugar remains high. They know that their blood sugars are very high and they are not bothered to get treated, or neither do they seek treatment. So please watch this video till the end. It is a very important topic which a person has to know, and if they are very serious of their health or want to have a healthy life, they need to watch this video till the end. Hello, welcome to Dr. Akin Clicks, and I am Dr. Akin. Today I had a visitor to my home. He is my relative. 1 year ago he had told me that, brother, my blood sugars are detected to be very high. And when he told me, I told that, brother, if your blood sugars are detected to be high, then please seek the help of a doctor. The doctor will tell you how to control the blood sugar. So you need to visit to the nearest healthcare provider or nearest healthcare facility to seek the help of a doctor to control the blood sugar. So I advised him to do that, but still he had not done anything. Today when he visited me, I checked his blood sugars because I have a glucometer with me in my home. I keep it usually whenever my relatives or somebody comes to me. I help them to do a random blood sugar test to know whether their blood sugars are in normal range or not. So on checking his blood sugar today, it was very high. I found that the blood sugars were 427 milligram per deciliter. Then I told him, brother, are you on any medication? Are you on any treatment for this high blood sugar? Because you have had told me this 1 year before, and then I had advised you to visit a nearest doctor who will help you to control the blood sugar by advising you what diet you need to take, how you need to control it by exercise and by medication. So I asked him, brother, why haven't you seen a doctor till today? He said to me that, brother, I have no problem. I am not facing any difficulty because of this high blood sugar. So I am not taking any treatment, nor I have consulted anybody. I am perfectly fine. I have no difficulty. Then I told him, remember, diabetes is one of the silent killers. The diabetes mellitus type 2 is basically because of the insulin resistance and also because of the inadequate insulin secretory response in the body. Because of this reason, the blood sugar remain high or remain elevated in diabetes mellitus type 2. Many a time the mistake which people do is that once they are detected to have high blood sugars, or more than one occasions they are detected to have high blood sugars, they just ignore it, thinking that it is not causing any problem to me. I am perfectly fine. I have no issues because of the high blood sugar. They think like this and they continue to do their activities of normal living as usual bothering about the high blood sugars. So in the long run, when a person neglects such very high blood sugar, then they will have long-term consequences. Normally we say, when your fasting blood sugar value is more than or equal to 126 milligram per deciliter, we say you have diabetes. Or when your random blood sugar is more than 200 milligram per deciliter, we say you have diabetes mellitus type 2. So when you have these values of blood sugar more than or equal to these values of blood sugars, you need to be alert. You need to seek the help of a doctor to control the blood sugars. If you think that I am not having any problem because of the high blood sugar, you may continue to live normally like you are doing today, and by ignoring high blood sugar, you may continue to do your work as usual for the next many years, say 3 to 4, 5 years. You may not have any problem, but one day you will have sudden difficulties. You will notice that you are not feeling well. Why? Because you had neglected the high blood sugar which was detected in you many years before. For some people, when their blood sugars are high, and if they are not bothered for the next 2-3 years, some for 4 years or 5 years, they do not find any difficulty. They continue to carry on their normal activities, thinking that I have high blood sugar, but I am perfectly fine and it's not causing any problem to me, and it has not caused any problem to me till today. But remember, as I had mentioned just now, that diabetes mellitus type 2 is a silent killer. It is one of the silent killers of human being. So you must by now know that if you neglect the high blood sugar which is in you, and when you are advised to take treatment related to high blood sugar, and if you ignore, you will have the consequence after some years. Then even if you say that, oh, I should have taken the treatment when the doctor had advised me, I should have taken the follow-up measures to control the blood sugar with a healthcare provider, then it will be too late. Remember, we have seen as a treating doctor that people who don't give importance to the advice of the healthcare worker or doctor after their high blood sugar is detected, and in the long run they have all issues related to high blood sugar, related to diabetes mellitus type 2. So what are the complications of ignoring a high blood sugar or ignoring a diabetes mellitus type 2? One day you may find that your kidneys have stopped functioning. The high blood sugars affects the kidneys. The kidneys will develop what we say as diabetic nephropathy. The kidneys will let micro or macroalbumin to pass in the urine. When the proteins, basically these albumins are proteins, when the proteins are passed in large quantity in urine, that means you are having diabetic complications of the kidney because of the high blood sugar. When the albumin levels are more than 300 milligram in the 24-hour urine collection, then we are sure that you have diabetic nephropathy, and the diabetes, uncontrolled diabetes, has affected your kidney. Similarly, the uncontrolled blood sugar level affects the heart. You will have coronary artery disease, you will have diseases related to heart, and uncontrolled blood sugar also leads to brain stroke. Uncontrolled blood sugar also leads to what we call as diabetic neuropathy. You will have pain, you will have burning sensation of your limbs, especially your lower limbs. You will have tingling sensation. You develop ulcers of the feet because there is no sensation in the feet because of uncontrolled diabetes mellitus, and that will lead to loss of sensation, loss of pain, and any injury will easily develop in your limb, and you can develop non-healing chronic ulcers. So after 4 to 5 years, when you have not bothered to control your blood sugars, or when you have not bothered to get treated because of high blood sugars, you can also have complications of the eyes. The complications of the eyes will start from the orbital region, that is the eye socket itself. Your complications related to high blood sugars of the eye will start. Then there will be corneal ulcers, the ulcers of the cornea, and the cornea will be very easily prone to many infections. Then the eye lenses will develop opacity. Because of opacity, there will be cataract, and the eyes also will develop glaucoma, various types of glaucoma. Because of the high blood sugar, there will be vitreous hemorrhage in the eye, basically bleeding inside the eye, and the eye will also develop macular edema, and there are chances that because of uncontrolled diabetes mellitus or uncontrolled blood sugar, you may develop complete blindness. Therefore, it is always to be remembered that when you are detected to have high blood sugars on more than one occasion, and the healthcare worker or doctors have told you that you are having diabetes mellitus, please go and get treatment. Please go and get advice from healthcare worker. You say that I have high blood sugars, but it is not affecting me, and I am not having any problem like the usual symptoms of diabetes mellitus, which we say polyphagia, like eating more, feel like eating more and more, polydipsia, that is feeling more thirsty than the usual, and polyuria, that means passing urine very frequently. You may also not have these symptoms, but initially when you are detected to have very high blood sugar, that is more than 200 milligram per deciliter in random blood sugar and more than 126 milligram per deciliter in fasting blood sugar, you need to be alert. Please go and seek help from the healthcare worker. If you neglect, then it will have long-term complications. One day you will develop, suddenly you will start to feel not well. And so please remember that high blood sugar or diabetes mellitus type 2 do not cause immediate serious consequences, do not cause immediate serious life-threatening problems, but if the high blood sugars or the diabetes mellitus type 2 is not treated, is remaining unattended, then you will have serious complications related. Then a bell will ring in your mind that yes, the doctor had clearly told me about these complications if not treated or if not bothered about the high blood sugar in the long run. So also please remember that if you are on any medication for diabetes mellitus type 2 but still your blood sugars are not controlled, then also you will have problem in the long run related to diabetes mellitus type 2 complications. If you are on medications or if you are on any advice related to diabetes mellitus type 2 given by health expert, please make it sure that while being on those treatment, while being on those advice, your blood sugars are well within the normal range when you are on treatment or while you are on those advice given by the experts. You may say that, doctor, I am on medication. Doctor, I am on all the advices what the doctors have told. But when you check your blood sugars, still it is not under control. Still it is not within the normal range. That means your medications or your advice is also not able to control the blood sugar properly or not able to maintain the blood sugar within the normal range. Then as an aware person, as an enlightened person, as a knowledgeable person, you have to approach your doctor, you have to approach your treating doctor, telling them that, doctor, I am following all the advices, I am following all the advices which are given by you, but my blood sugars are not controlled. Then the doctor will help you to further strengthen that control of the blood sugar. So please remember that while on treatment and that treatment is not controlling your blood sugar, that is also a problem. Please always remember that while on treatment, our aim, our motto should be that the blood sugars are controlled within the normal range. So please remember that it is not only the treatment, not only the medications that are going to control the blood sugar, as every doctor tells that apart from the medications for diabetes mellitus type 2, you need to control your diet. Diet control also plays a very significant role in controlling the blood sugars within the normal range. And then you need to do brisk physical activity in a day, at least for 45 minutes to 1 hour daily, and at least 5 days in a week. So the blood sugars can be controlled by the combination of everything: diet control, physical exercise, and finally medications. So please sincerely follow all these advices, then only your blood sugar will be controlled in a normal like person. Then once your blood sugars are controlled because of your diet control, because of your physical activity, and because of the medications, when your blood sugars are controlled within the normal range, you can lead a normal life without any complication, and you can lead a very healthy and long duration life as much as you want to live or wish to live on this earth. But if your blood sugars are not controlled, if your blood sugars are totally deranged and out of control, then you may succumb to the complications of diabetes anytime. So please be an active person, please be a smart person to control your blood sugars, and please seek the help of healthcare experts so that they will help you to control the blood sugars. Many times people tell me, "Doctor, I am taking treatment from some alternative system of medicine." I tell them, and it also must be known to you also, that as a treating doctor, we have no complaints about any system of medicine that you are following. But when you follow any system of medicine, please ensure that that system of medicine should control the blood sugar, should control the blood sugars within the normal range. And if your any other system of medicine is able to control the blood sugars within the normal range, then that's a thumbs up for that system of medicine. But if you say, "I am following alternative system of medicine for treatment of diabetes mellitus to control the blood sugars, but still my blood sugars are not controlled," then that means that system of medicine is not being useful to you or not effective for controlling your blood sugars. So I have no issue with you following any system of medicine other than the modern medicine, but when you follow any other system of medicines other than modern medicine, please ensure that that system of medicine controls your blood sugar and you are able to live a life of blood sugar controlled life, and you are able to live without any complications related to diabetes mellitus type 2. So I hope you will like this video and this video has been useful to you. If you like this video, please give a like. And if you want to continue to receive latest regular updates on health and health related issues in a very simple way without any sophisticated medical jargon, which the presentation is simple and easy to understand, then please subscribe my channel so that whenever I upload a new video, you will receive that notification and you will never miss a video whenever I upload a new video. Take care of your health. Be serious to have good health. Make effort to remain healthy. See you. Bye. Till then, thank you.